Dr. Eswaran, I was wondering if you might be able to comment on some of the potential complications of IBS. Is pain a sign that there's damage going on in the body, that something bad is going to happen to patients with IBS?
I think that's a really common fear that patients have. So, for example, patients often think, oh, I have all of this diarrhea. Does that mean that I have cancer? Or I have some pain after eating? Does that mean that there's some inflammation that's causing some greater harm? And the short story is that the answer is no. So while IBS greatly affects your quality of life and mood, it doesn't increase your risk of any sort of more severe or worrisome conditions down the road. And we know that from many, many years of data. But that doesn't mean that there aren't complications related to IBS. And the hugest complication is really, as I mentioned, is your quality of life. And so the severity of symptoms really varies a lot and impacts the quality of life quite a bit. That's different between patients. But the pain, bloating, fatigue, often diarrhea can really cause patients to miss work, often miss social functions, will often prompt patients to plan their life around their IBS symptoms. And I would call that a complication related to their chronic disease. In addition, patients with IBS are also a lot more likely to have other conditions that kind of go along with your irritable bowel syndrome. So, for example, fibromyalgia, migraine headaches, interstitial cystitis are all very much diseases that we seem to cluster together. And we're not really sure exactly why, but it probably does have something to do with a central process and maybe related to the gut brain interaction.